Folks, we are back here in Ways and Means on Wednesday, April 16th. It's 10:30 a.m. and we're going to take a little more testimony on S51. That's the bill that just came to us from the Senate, the Vermont Unpaid Caregiver Tax Credit. We got a walkthrough from Ledge Council last week and heard a little bit about the somewhat unknown fiscal impact. And now we are hearing from some folks in the field to tell us about the need for this. Meg, hi, would you like to join us?
I would love to do this.
Wonderful.
So nice to be in this committee for the first time. I have spent most of my time in the State House in policy committees, and so it's really nice.
This is also a policy.
It is a policy committee. That's tax policy. Exactly. I'm going to talk about issues related to tax policy, but first time I've been in this committee and really appreciate you taking the time to learn a little bit more about this bill and what it's about. I am Meg Polite. I'm the policy director for the Vermont chapter of the Alzheimer's Association. And I thought what I would do is I want to just take a little time to kind of just share the reality of what this looks like, who these caregivers are. I did listen to your testimony on Tuesday last week when you were doing the walkthrough. And so I just wanted to share a little bit more about sort of who are we talking about? What are we talking about? What does their life look like? And then at the end, I did have some feedback based on that around a couple specific pieces of the bill that you might be interested in digging deeper in or thinking a little bit more about. So I did attach to my testimony 4 different fact sheets, which I think you might want to look at, and all of the numbers are referenced in this testimony. So that's where I got my numbers from. And hopefully you'll find those helpful. So according to the Vermont Department of Health, 1 in 4 caregivers in Vermont care for someone with Alzheimer's disease, dementia, or a related neurocognitive disorder. And in 2020, which is the last year that we had numbers for, there were 12,800 Vermonters with Alzheimer's. And it says in my testimony diagnosed, that is a typo. About half of them do not have a formal diagnosis. So that's really important to think about with this bill that requires the diagnosis. And you're wondering, how are we going to narrow it down? This is one of the ways that you're going to narrow it down, and potentially a way that we can continue our advocacy work on the ground about the importance of a diagnosis and helping people get there, because early diagnosis saves time and saves money for families, for the state, for the federal government, et cetera. So that's something that we all really want to work towards. And we know that number 12,800 is low because it doesn't include people under 65 or, as I said, the misdiagnosed or others. So on the other side, last year, there were 20,000 Vermonters who provided 29 million hours of unpaid care to loved ones with dementia, and the value of that care was $773 million. So caregivers for those living with Alzheimer's or another dementia play an essential role in maintaining the quality of life for their loved ones, helping them live independently in their homes or their communities where they decide to live. And they face much more substantial emotional, financial, and physical difficulties, including time-intensive demands, than those who provide care for people without dementia. On average, they spend 27 hours more time every month caring for the person that they're with. So the amount of time that you spend on caregiving increases over time. Dementia is a disease that can last for up to 20 years. Generally, it's not that long, but some people are caregiving for very, very long periods of time. So one study shows that those caring for people with dementia required 151 hours of care per month at the beginning, and it increased to 283 hours per month 8 years later. So you're just seeing how that's ramping up. 1 in 4 Vermont dementia caregivers spend 40 hours or more a week on dementia-related care. And that really causes prolonged and devastating tolls on caregivers in many different ways. 1 in 3 caregivers have been doing this for 5 years or longer. As dementia progresses, these duties can be needed 24 hours a day. And I think you talked about that a little bit, but there is a propensity of some people with dementia to really have their time clocks flipped around, and they decide they want to be active in the nighttime hours. So it's very possible that somebody is caring for somebody during the night because that's when they're up and about. And There's a brief that I attached, which is the specific brief on Alzheimer's in the workforce, but just a couple statistics around that, around caring for someone with dementia and your ability to work. 6 in 10 caregivers were employed last year. 57% had to go in late or leave early to meet caregiving demands. 18% went from full to part-time, and 9% had to give up work for caregiving duties. And I know other folks testifying today are going to talk more about the workforce impact. And then I wanted to talk a little bit about sort of what is the out-of-pocket expense. I'm not talking about the time expense of caregiving, but the actual out-of-pocket expense for caring for someone. So caring for someone without dementia generally has an average out-of-pocket expense of $6,887. For that family member caring for someone with dementia, that goes up to $12,388. And generally, it's always about double what it would cost for someone without. So as a result of this financial strain, many families significantly cut back on savings contributions and other spending. You know, nationally, 41% of dementia caregivers have a household income of $50,000 or less. And it is not at all unusual for people who have really robust financial plans to watch that drastically decline as they begin this dementia journey. And in some ways, they're encouraged to draw down their resources because sometimes there are more services available if they can reach lower economic levels. So we're really talking about people that are at the lower end of the income, and people where $1,000 would have a meaningful discount impact. Nearly 40% of caregivers reported the food they purchased often ran out before they could afford more, and 30% shared they had to eat less due to care costs. The total lifetime care cost of caring for a person living with dementia is estimated at about $400,000. And of this, 70% is borne by families through either out-of-pocket health and long-term care expenses or from the value of long-term care, of unpaid care. So I did just want to say one thing about the impact of caregiving on women. And I know Carrie is going to speak from the Commission of Women, but it is often more acutely felt by women and felt by women across the generations because of decisions that have to be made when you know that you're responsible for somebody else. Approximately 2/3 of caregivers are women. More specifically, over 1/3 of dementia caregivers are daughters, and 1/4 of dementia caregivers are sandwich generation. So they're caring for their children at home and their aging parents at the same time. Alzheimer's disease takes a devastating toll on caregivers, but the majority of Vermonters with dementia report they want to remain in their home or community. And any support that we can provide to make this possible is not only beneficial to families dealing with dementia, but to our entire long-term care system, which is stretched very, very thin. So I really can't tell you enough about how important it is that we keep these folks able to care for their loved ones, because there just are not other opportunities that are out there for them. We don't have enough adult day programs. We don't have enough memory care beds. We don't have enough social opportunities for people who have dementia where they can safely go and be cared for. So we really need to bolster the caregivers to keep their health and well-being as strong as possible, and to keep them able to do this of what they think is what they believe and what they know is right for themselves and for their families. And I would just say S51 is just a really tangible way to provide the much needed recognition to unpaid caregivers and slightly alleviate the overwhelming financial burden. So when I did listen, there were a few things that I wanted to point out that I heard that maybe need further look, but there was quite a bit of discussion about who would be eligible to receive the credit. And I was actually under the impression from all of my time in Senate Finance that this was for people caring for adults, not for children, because there are already a lot of programs for children. And so you might want to actually consider just making that change to the bill on page 2, line 18. So it would change the word individual to adult and say providing care for an adult. That was really what my impression of where the bill was going, but you may want to keep it available to everybody. I did want to clarify that the National Credit for Caregiving bill has been reintroduced in partnership with AARP, who I know you're going to hear from later, and it is one of our Alzheimer's Association's federal priorities. That bill proposes up to $5,000 non-refundable federal tax credit for eligible family caregivers and requires a lot of things that this bill doesn't require, which is like they have to keep their receipts and then they can take that amount off of receipts. We were really trying to say with this, family caregivers are stretched incredibly thin. We know they're putting the time out there. How can we document this through the medical system, but not make it so hard that it's impossible for them to put the time in to even qualify for $1,000? And I hope my testimony has provided some clarity on what caring for a loved one with dementia entails. The bill requires a person receiving care to need assistance with the activity of daily living, ADLs, which is something that we notice here. But sometimes those don't actually reflect the urgent need or the amount of time required for a caregiver. For instance, can the person dress themselves? Yep. Can they dress themselves appropriately to go outside in Vermont in the winter? Maybe not. Can the person feed themselves? Yep. Do they remember that they ate breakfast, or did they eat breakfast 3 times? Or did they completely forget to eat all day long? So I just encourage you to think about that. And maybe consider including also IADLs, which are instrumental activities of daily living. So it says needs assistance with ADLs and IADLs. And I do believe that it's redundant, the last part of the line that says remove it, that says home health care and assistance remaining safe at home, because that's what both of those things measure. I wanted to finish just by talking a little bit about the actual impact of the $1,000 tax credit, because as you probably know, we had Alzheimer's Awareness Day at the State House last week on your big day where your bill was on the House floor. So we're sorry that we missed you for some of that. But this bill was one of 3 bills that we raised and really did a presentation on and had a robust discussion about. And one person stood up and literally said, am I correct that this bill would provide me with $1,000 tax credit if I attest that I provided 1,040 hours of care? That's less than $1 an hour. Like, is that really what we're talking about here? And we had a really powerful and robust conversation in that room with unpaid family caregivers. And I really do hope you'll make time to hear from some of them in this room so you can understand it. But together, we really decided that based on the financial challenges that folks are facing, the $1,000 would actually be tangible and be really important to some of these folks, allowing them to, you know, weatherize a room, fix a roof, put tires on their car, or take care of their own health. And I know you received an email yesterday with the letter that was signed by all of our members. I did bring it in. I know you guys don't use paper, but I made a copy and I thought I'd leave it here because it might be easier to read some of the comments on it. But overwhelmingly, we really supported that. And in addition, the recognition of the fact that people are caregiving and that they're making this much sacrifice and how hard it is really cannot be understated. People were just overwhelmed by the possibility that they would be seen. And I thought that was really, really important. So I just wanted to close by saying, I know there's a projected $6 million cost to the bill, and I understand that this is a significant amount of money and we're in a really tight budget cycle with a lot of unknowns. And I feel that, but I do want to just bring you back to that testimony in the beginning that Vermonters have provided 29 million hours of unpaid care last year with a value of $773 million to our state. They are really saving us money and creating opportunities for us to do other stuff with our resources and to support other groups. And so I really strongly urge you to recognize this work and the sacrifices that they're making and to advance the tax credit for them. Thank you.
Do you have a sense of the overlap between people receiving Social Security and folks who are providing unpaid care right now?
I know that it's like, there was an age one, and a big portion of unpaid caregivers are over 55. I don't remember, security starts at 65, and I'm not sure if we have it broken down starting at 65. It's, let's see here, it says 65 plus is 32.4% of dementia caregivers. Of course, all of my testimony has been on just dementia caregivers, not other caregivers.
Thanks for your time today.
You are very welcome. Thank you so much for taking this up, and I look forward to working with you if you have other questions.
I believe Carrie Brown's running a little bit late, so Colin, if you want to join us. Good to see you again.
Morning, it's good to be back.
Where's yours?
Great. Thank you, Chair Kornheiser and members of the committee. Colin Hilliard, I'm the Advocacy Director for ARP Vermont. ARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering Americans 50 and older to choose how they live and age. We have 38 million members nationwide and 110,000 members here in Vermont. We're very supportive of this unpaid caregiver tax credit. ARP works to support family caregivers and common sense solutions that will save them time, money, and provide them with more support. We really see family caregivers as the backbone of the nation's long-term care system. It's a system that we all know is under extreme strain right now across the country, especially here in Vermont. And these folks, their assistance helps save taxpayers billions of dollars by helping delay or prevent expensive nursing home care and unnecessary hospital stays. Many family caregivers face significant out-of-pocket expenses relating to providing that care. And I wanted to just call folks' attention to, we did in 2023 a Vermont voter survey on family caregiving that I sent around. And that probably has the most recent survey data on family caregiving in Vermont. And so in that, we found that today more than 1 in 3 Vermont voters 40 plus have experience as a family caregiving, and 62% say that they're at least somewhat likely to be an unpaid caregiver in their future. The median age of a current family caregiver in Vermont was 60, and family caregivers are most likely to be caring for a parent, particularly their mother, 40%. We also have a study that came out in 2023 valuing the invaluable report, found that in a little bit, this is all family caregivers in Vermont. There's 70,000 providing 66 million care hours every year. The estimated economic value of that was 1.23 billion. So these folks, the work that these folks do, this unpaid work, provides an incredible amount of economic value to the state. And that's not to mention the cost that they save in keeping folks out of a higher cost facility. These folks are often stressed and overcoming the physical, emotional, financial, time-consuming demands required to care for a loved one. They spend on national average of over $7,000 a year out of their own pockets and an average of 20 hours a week. And just back to that 2023 poll, the survey of voters 40 plus, 61% of family caregivers pay for expenses out of their own pockets. And that can be covering the cost of transportation, home modifications, and medical equipment. Those are the top 3 most common out-of-pocket expenses. 3 in 4 say that they're feeling stressed emotionally, and 1 in 3 say they're feeling financially strained. And just one more data point too from that, 2 in 3 current family caregivers say they're providing care while working. So these are vastly people in our workforce. We know we have a workforce shortage, and so providing any assistance that we can. These are folks that most of them have had to adjust their hours or had other issues of trying to stay in the workforce. The number one thing is adjusting their hours. And so if you're working part-time, you're having to reduce your hours. You're losing that income while providing this unpaid caregiving. Also wanted to, because I know Meg talked about activities of daily living and instrumental activities of daily living. There is a breakdown in there on some of the most common and what those look like. So for just trying to find it here, for instrumental activities of daily living, transportation, 88%, preparing meals, 85%. Those are just so critical to when we talk about those. I think that's most of my testimony. We're very supportive of this. This sends a really powerful message to family caregivers that their unpaid work is valuable and valued by the state and appreciated. I'm also happy to, we have tons of caregiving stories from Vermonters that we've collected over the years at AARP. I think if you do have the time, we'd love to connect you with them and have them come in and tell their stories. Happy to answer any questions.
Thanks, Colin. You're in the unfortunate position of being the second person who said something that I have questions about.
Yep.
So the idea of our tax code being used to just like recognize and value people makes me really uncomfortable.
Mhm.
And so I think I think the tax code should be used for making sure that we have sufficient money for the state and making sure that Vermonters have sufficient money to spend. And so I really, I think we have regularly passed tax credits for political reasons, for emotional reasons, for whatever reasons, or because they started off really big and meaningful, and then politically we went them down so that they don't make a difference anymore. And frankly, that often feels to me like an entire waste of revenue. Whereas if it was triple what it was, it would not be a waste of revenue anymore. But $300 to help for a rebate for someone to buy something that's $20,000, right? Like what is the point of that? And so I would love to get like a little deeper on moving away from it helps people feel valued and more it makes a difference in people's actual incredibly difficult life that they are navigating, because caregiving is no easy project, right? So I wonder if you have any tangible.
Absolutely. And
Yes.
thank you. And
Yeah.
really appreciate that question and absolutely understand that from the hard work that you all have to do as policymakers. And I think when we talk about, what does $1,000 tax credit look like and the impact that it can have, so many of these folks are, especially as you age, and right, the median age here is 60 in Vermont, our survey found. So these are increasingly folks on fixed incomes. We have, with inflationary pressures, affordability is such a concern for Vermonters right now. And I think $1,000 can go a long way when you are the amount of transportation you're doing to medical appointments for folks like this, the gas cost in that. We're in a rural state. This is something that impacts rural folks, I think, especially. I think also home modification costs, $1,000 of, so much is not covered in home modification. And that's another area that this is something that would really have impact in making people's homes safer and more accessible. That all ties into keeping them out of higher cost facilities that would fall on the taxpayers additionally.
You gave an estimate of how many unpaid caregivers are in Vermont?
70,000. That's from the 2023 Valuing the Invaluable report that AARP did. And that was a report that kind of pulled together a variety of different studies that have been done on caregiving.
Thank you.
You mentioned this $1,000 might help with home modifications and or reimbursement of transportation expenses. Both of those items are available on the federal tax credit or the federal itemized deduction list. Do you know how many of the people that participate in this caregiving enterprise are able to take advantage of that or do take advantage of that?
Yeah, thank you for that question. I think I don't know how many of the 70,000 caregivers in Vermont itemize their deduction. We may have some data on that. AARP has a lot of data on caregiving. And so I would be happy to look into that and see what I could find in that regard. Yeah.
I mean, I just want to recognize that there are ways of recovering some of those costs through other methods.
And I believe on federal but not on state level, I don't believe.
No, I don't believe on the state level.
Marty, that might be a great question for the tax department. Because I'm very curious about this. But, yeah. I don't know if they'd be able to get to that granularity, but it might be worth asking. Yeah.
That sale.
Yeah.
How those itemized deductions work. I mean, with the change in the federal itemized deductions
Yes.
being raised so high, you know, people probably not itemizing. They used to, but.
Certainly not the people who want to give tax credits.
Right.
Probably, yeah. Anything else for Colin? Thank you very much.
Thank you all.
Mary Hayden?
Good
Thanks for
morning.
joining us.
Thank you for having me. For the record, Mary Hayden, I'm the Executive Director for the Vermont Association of Area Agencies on Aging. And I'm a resident of Barry City. And I'm really happy to be here today because I've never been before your committee before.
We're glad to have you.
I know nothing about tax policy. Just like saying that up front. But I'm really happy to be here and excited about S51. And let me just start by sharing with you that, and hopefully there are 5 area agencies on aging in Vermont covering the state. I'm going to give you a little handout as I wrap up today to show you where your constituents can go to get help if they need it. And we provide a wide range of services for older Vermonters as well as some disabled adults as well. And it ranges from case management services for like long-term care coordination, home delivered meals, or commonly known as Meals on Wheels, community meals, caregiver supports, information and assistance helplines. We do Medicare counseling for free, and education around Medicare for free, wellness activities and programs, outreach, and application assistance for state benefits, like SNAP, LIHEAP, VFARM, Medicare, low-income savings programs, housing, field assistance, et cetera. So getting into the portion of our services and programs for unpaid caregivers, it's just woefully underfunded in relation to the population we're looking at here. So yeah, the AARP, we rely on AARP data that we have 70,000 unpaid caregivers in the state. Huge bargain, right, to the government. They're providing free services to this population. So we're really not standing up the workforce that we should be to help people with caregiving in their home. And almost 2/3 of those folks are women, which means that it has a more detrimental, disproportionate impact on their ability to earn income and also to save for the future, to have Social Security earnings and other pension or retirement opportunities. So it's disproportionately impacting on the female population. And when Carrie gets here, hopefully she'll share more with you on that. But data also shows that there's a pretty significant impact on social and health of these folks. We're looking at 60% of caregivers with chronic health conditions themselves, and those can get worse due to caregiving without having any relief from the caregiving. High rates of depression, like 35%, and like 11 or 12% in poor physical health. So this population, providing all these free services to all of our loved ones with chronic illnesses, they're at risk themselves, and the caregiving itself can become so arduous that it puts them at higher risk for these things. So we see things like, and if you've heard this already from your witness, but their income can get depleted, and their employment can be disrupted, and it becomes harder and harder to afford some of the things needed to provide the caregiving services that they're providing in their homes. Higher burdens of stress and other mental health outcomes, strain, difficulty navigating care transitions as compared to other caregivers. That means, and that's really applying to those who are caregiving for those with dementia and related disorders. Greater risk of social isolation and loneliness, especially if your loved one has dementia or related disorder, because there can be a stigma attached to that. And we find that they tend to just stay home and stop engaging in the things they used to engage in. And again, that impacts on their health and well-being and that of their loved ones as well. So while I'm not an expert on tax policy, I'm here to emphasize the importance of respite for caregivers. And there's very little funding available to caregivers in our state. Our agencies can provide services to unpaid caregivers under two programs. One is under the Older Americans Act programs for caregivers, and that is a lot of education, outreach, training to learn about how to be a caregiver and learn about the illness and needs of your loved one or care recipient. We have a very modest state-funded grant called the Dementia Respite Grant, which has been at $250,000 for 20 years, and we have not succeeded in increasing that yet. We've tried the last 2 years. So overall, we are serving 400 caregivers per year, and the impact $1,000 could have on these households is really significant. It doesn't sound like a lot, but given the population we're dealing with, who are primarily lower middle income people, having this $1,000 tax credit can make a big difference, as you heard, whether that is for, creating making a repair in the home or creating an accessibility change in the home, but also to maybe use that money to pay for some respite services, or to pair that money with other funds that may be available to help you pay for respite. Respite is really key for us to assist our unpaid caregivers to maintain their health and well-being so they can continue to function as a caregiver. That's what they want to do. They want to be able to serve as a caregiver for their loved one. So while it's not a great deal of money to add to a household, we are very strong supporters of the bill because it does help. All of this helps our caregivers. Couple of things just about, ease of access. What we find when we are supporting unpaid caregivers is they can get overwhelmed with all the paperwork they have to complete and fill out, including paperwork from us, unfortunately, which is required, under the grants that we operate under. But so any way to ease, the sort of paperwork or application process for them for this benefit would be, I think, greatly appreciated. I think our caregiver staff will no doubt be assisting them with this kind of paperwork, and we'll hear about that. And also to the extent that, we can communicate effectively with folks about the program and how to access the program is all those things are, I think, very helpful for the staff that serves caregivers and caregivers as well. What we wouldn't want to see are people overwhelmed, so they just don't even are able to complete the paperwork, get the certifications that are needed. That's really it. We're strong supporters of S51, and I certainly encourage you to ask any questions if I can help you, except texting policy. And I appreciate your time and attention today. And I do have a handout just to warn you, so if I could start passing that around.
Yes, we usually don't do paper in here, but yes.
I'm hearing that more and more. I'm feeling a little dated here with my paperwork, so.
It's just, it gets to be a lot.
I know.
Yes.
But this is pretty and it's in color. And this has a.
I'm sure it's prettier than the other paper we have.
Service map. So, if you have a constituent that needs assistance, you can point them in the right direction. Can I start over here? Thank you kindly.
Thank you. Representative Higley, did you have did you want to say something before? Or did I? Okay. It was your hand. Thank you, John.
Thank you. Nice to hear from you. Following on the chair's comment a while back about using tax policy to do different things. I guess I'm sort of paraphrasing it. I'm aware more and more that we not inappropriately, but differently are asked to use tax policy to affect what may be actually income distribution among different classes of people. I mean, for instance, you've outlined very clearly why respite care outside dementia care workers could use a break, shall we say, to put it mildly. But we run into frequently into other examples of the same sort of thing. And I can see merit in each one of them. And then say to myself, but wait a minute, is this the right way to go about doing this? And I'm not arguing with you. I'm just reflecting out loud here that, leave my phone off, but anyway. Yes, this was the question. Is this the best way to go about doing it? When we're actually talking about in the broader context, a social program, social healthcare program, which by necessity it deserves attention. But when we do it in bits and pieces, one for respite care workers, one for this, one for that, are we defeating our purpose because they get tangled up in each other and they use resources that other people would argue should be used differently. So I'm just putting this out there as, now what are we doing? As following on Chair Kornheiser's question, is this the proper way of doing it? And I'm not saying we should not do it, but the chair got me thinking.
Yeah,
So,
I love philosophical questions.
well, anyway, so I just.
But I guess what I would say is, I don't want to get into a policy debate,
Sure.
but what I learned in law school is that tax law is supposed to advance policy, public policy.
Right.
That's at its core.
Yeah.
And we make choices about what to advance, just like we make choices to give corporations tax breaks, for example.
Right, we do.
We make choices to do that. And this is one example of that. I think I know it's not supposed to pat someone on the back either. That's not the point, but I see it as just a way to really make life more affordable for this group of folks who are
Understood.
really struggling with affordability and maintaining their health and well-being. And as I said, if the government's getting a huge deal here from these folks because we really need more workforce to be doing this. So I guess you would just be deciding what public policy, taxing policy to advance.
Understood.
I hope that helps. Yeah.
Well, earlier, and you were in the room, or I may have heard it anyway, about EITC and child tax credit, which is a broader group of beneficiaries. But in a roundabout sort of way, we're talking about the same thing. Trying to provide extra resources for people who deserve it. And as we said, there are downstream multiplier effects of the EITC group, just as there would be of your people you're representing here, advocating for today. So I'm just pointing that out. This is
Yeah, thank you.
there will come a point.
Just to clarify too, that EATC really will help a lot of older.
Understood. Okay, enough said, Jim. Thank you.
Thank you very much for joining us.
Thank you.
Really appreciate it. Carrie Brown is in another committee and not able to get away, but she has submitted written testimony that folks can find and maybe read when we wrap up today. And so we are going to move to S27, which is an act relating to medical debt relief and excluding medical debt from credit reports. We heard testimony yesterday from both the tax department and the treasurer's office that there should be no federal or state tax impacts for folks receiving this debt relief, and a little bit about how the program works. Does anyone need anything before we have a motion on it?
Just one clarification. I want to make sure that I heard, can't remember which ledge council individual it was, but generally these nonprofits use between 10 and 15% of an amount like that for doing the project. Did I hear that correctly?
I don't think Jen Carby spoke to the Ledge Council, spoke to that. Becky Wasserman, who used to be Ledge Council, was here. She actually works at the treasurer's office now. And she, I think, was looking up the fee that the organization is using, but talked about a bunch of other funding that they have for this as well, like Mackenzie Scott Foundation money.
I think she said $80,000 was kind of a round figure that she was using, but between 10 and 15% of, the $1 million could go towards the nonprofit's ability to do the job. Did I hear that correctly?
I honestly don't remember that number off the top of my head either. We could, yeah,
I was just gonna say, I don't remember the number, but she definitely said that it was part of that $1 million. Close to me, but.
Thanks.
she did say, yes, she did testify that the sum was totally inclusive of everything and that no additional money would be needed from the state. And we can get, before it's on the floor, we can get an email from her about what the total of the fee is, if that's helpful.
I just
Okay.
would like to know for sure what I've been
Bill, are you looking?
using for a figure.
Bill's looking through his very comprehensive notes as well. Anyone else need anything? Would anyone like to make a motion to find S27 favorable?
I would make a motion that we find S27 favorable.
Thank you. Representative Wozniak moves that we find S27 favorable. Any discussion? Seeing none, if the clerk could please call the roll.
Representative Brannigan. Yes. As Representative Burkhart, I vote yes. Representative Feltes.
Yes.
Representative Higley.
Yes.
Representative Holcomb.
Yes.
Representative Kimball.
Yes.
Representative Maslin.
Yes.
Representative Odie. Representative Wazazak.
Yes.
Representative Canfield.
Yes.
Representative Kornheiser.
Yes.
We have passed the bill favorable, 11-0.
Thank you very much, everyone. So that's S27. We have passed favorably 11-0. Appreciate you all. And we are done for the morning. I will see you after the floor. We are going to return to the topic of pilot funds. Near the end of our work on that before crossover, there were lots of questions about how it was calculated and if it was calculated right. And so we're going to dive into that for a little bit. I don't know if anything will come of it this session, but we're going to do our due diligence there while we have time.